Hi, everyone. Thank you so much for joining tonight's event, A Remedy for Recovery, Medicare for All during COVID-19. My name is HEBAH, and I am the Organizing and Policy Associate with the Congressional Progressive Caucus Center, a nonprofit organization that identifies and develops solutions to build a more just, equitable, and resilient nation. I want to begin tonight's event by remembering and honoring the more than 539,000 people killed by the coronavirus over the past year in the US. We mourn with the families who have lost loved ones, the people who are still struggling to recover after weeks or even months of illness, and the families whose lives have been upended by illness, economic disruption, and isolation. As we'll discuss tonight, this pandemic was a preventable tragedy. A new report from Public Citizen found that a shocking 40% of COVID infections and 30% of COVID deaths were tied to people who didn't have health insurance. Over 27 million people across the country lost their health care during this country because they lost their job. It didn't have to be this way. And while in many ways we're beginning to see some life-saving progress in vaccinations, COVID-19 has made even more clear the need to put our collective healthcare over corporate profits for a few greedy insurance executives. It is unacceptable that 87 million people in this country were uninsured or underinsured even before the pandemic. These are policy choices, and we can and must choose differently. But we also have much to be excited about. For the past several years, Medicare for All has consistently polled above 70% total support among voters, making it one of the most popular policies. And just last week, Congresswoman Pramila Jayapal and Congresswoman Debbie Dingell introduced the newest Medicare for All bill with a record-breaking 113 original co-sponsors, more than half of the House Democratic Caucus, and endorsed by more than 300 local, state, and national organizations. For those of you who need a quick reminder of just how transformational this bill is, let me highlight a few things Medicare for All would do for working families. You'll still be able to see your favorite doctors. You'll still have access to primary care, maternal care, mental health care, vision, and dental care. You'll have actually affordable prescriptions and long-term care services and support for you and your family. And all of this without copays, deductibles, private insurance premiums, or other cost sharing. It's within our reach. But it's not going to happen on its own. It's taken years of organizing in communities across the country to get us to this point, and it'll take even more work to get it across the finish line. But here's what I also know. When we come together across race and place, we can build a truly universal healthcare system that guarantees high quality care for everyone, no exceptions. And with that, let's talk about exactly what work lies ahead. Tonight, we're lucky to be joined by an incredible group of special guests, including medical professionals, community organizers, policy experts, and a special congressional guest. Please join me in welcoming SOFIA SEPULVEDA, an organizer with the Texas Organizing Project, special congressional guest, Congresswoman Pramila Jayapal, who represents Washington's 7th District, Dr. Abdul El-Sayed, a physician, epidemiologist, and educator, Dr. Micah Johnson, a physician, healthcare researcher, and policy analyst, Dr. Donald Berwick, an esteemed healthcare system scholar, Dr. SRIRAM, the co-founder of the All Means All campaign and a practicing pediatrician, and last but certainly not least, MELINDA St. Louis, the director of Public Citizen's Medicare for All campaign. What an incredible group we have tonight. I'm so excited to introduce our first guest of the night, SOFIA SEPULVEDA. SOFIA is a first-generation Mexican-American trans-Latina healthcare organizer for the Texas Organizing Project, an affiliate of the Center for Popular Democracy. She is the co-lead organizer for the Medicare for All March in San Antonio and the San Antonio chapter of the Million Women's March in Washington, as well as the co-founder of Trans Power San Antonio. SOFIA has been a strong advocate for expanding healthcare access. SOFIA, thank you so much for joining us for this important conversation. Can you share with us how COVID-19 has affected you and your community? How has the pandemic changed your fight to expand healthcare?
Thank you, HEBAH, for having me here. And thank you all for showing up tonight in the Congressional Progressive Caucus Center for putting this event together. So I can tell you that it has taken a toll in many of us who were already struggling before. It has made access to care scarce and increased housing insecurity, along many other things. And I won't say it has changed, but it definitely has energized this movement. So during the beginning of the pandemic, we saw how people deemed hospital workers, frontline workers, grocery workers, teachers, and delivery drivers heroes and essential. We also saw insistence to keep our economy going and thus putting our community in danger. And if you're wondering why Black and Latino folks have higher deaths and infection rates with this pandemic. Think about this. We have the least access to care. Majority of us work in the service industry. We are grocery workers, gig workers, or working in industries where we do not have the privilege to stay at home working. We also saw how we have prioritized jobs rather than people, and with that, prioritize protecting wealth instead of protecting the most vulnerable. In Texas, we are no longer essential. We are expendable. When the city of Dallas demanded to prioritize grocery workers and people of color, Abbott denied this by stating that they will stop providing Dallas with the vaccine, so the city desisted. With our governor getting rid of the mask mandate, now our community more than ever needs help. First, let's make sure to say that this virus is not racist. However, the practices in this country, in my state, are indeed racist. This is why this job is important. We need to demand our Texas governor to expand Medicaid now, which will help cover over 1 million folks. But even then, the fight we know is not over because we still have 3 million people without insurance. That is why we are here today. To demand our representatives, those who say they care about our Black, Indigenous, and Latino communities, but are not willing to put their skin in the game to fully support a legislature that will literally allow everyone, despite of country of origin, race, creed, gender, or sexual orientation, to have access to needed care, regardless of the job that they have or the amount of money they have in the bank. Medicare for all. This pandemic has shown that putting politics over people is dangerous. And tying healthcare with your job is also dangerous. And we saw folks across the country who saw their jobs disappear, and with that, their healthcare coverage. What do we seem to do? We continue the game of politics, showing that we have no spine to fight for our people, and henceforth, ensuring that more deaths are caused by the lack of care during a worldwide pandemic. This crisis was not just seen this during the pandemic, but this COVID-19 put the disparities in a magnifying glass. And even before this, right? 60% of people in the United States had to file for bankruptcy due to medical bills. And about 40,000 people die of illnesses that could have been easily prevented if only they had access to healthcare. So this month, as you just mentioned, the 2021 Medicare for All bill, authored by the amazing progressive champion, Congressman Jayapal, was introduced. So I'm calling on our state representatives who have not yet supported this bill to do so immediately, like Sylvia Garcia, whose district has a staggering 38% of uninsured folks. Colin Alred, whose district has 30% uninsured population, or Joaquin Castro, whose district has 25% uninsured folks, to stop playing politics and stop playing with the lives of our people and support this bill. We can't say that we care about our people while at the same time denying basic rights like healthcare to millions of us. You can say you support immigrants without supporting this bill because it's the only one which allows our immigrant community to have access to care. You can say you want to end gun violence and not support this bill because you cannot only care about the dead and care less about the ones left behind who might have PTSD or been in the hospital with a wound and accruing thousands of dollars in debt. We can't say you support Black lives while denying access to care in communities of color. You can't say you support trans rights while denying access to needed treatment. So if we believe in freedom, we then need to support this bill wholeheartedly. For this bill does bring true freedom. Freedom to choose your own doctor, just like you said, pharmacy and hospital, and not be dependent on your insurance to tell you where to go. Freedom to follow your dream and to start a business if you wish, without the fear of losing your needed care. Freedom to live your life without the fear of being covered, because we will all be covered from cradle to grave. So that's what we're here to not only bring light to this crisis, but tell our representatives that they need to support Medicare for all in order for our population to continue thriving, not just surviving.
Thank you so much, Sophia. Thank you for coming on and sharing all of that with us. And you're right, the policies and the systems are racist and something needs to change. So thank you so much for joining us. I hope you'll stay on and listen to our other speakers. Thank you.
Thank you.
So I'm so honored to introduce our special congressional guest speaker, Congresswoman Pramila Jayapal. Congresswoman Jayapal is the chair of the Congressional Progressive Caucus and the co-chair of the Women's Working Group on Immigration. Prior to serving in elected office, Congresswoman Jayapal spent 20 years working internationally and domestically in global public health and development as an award-winning national advocate for women's, immigrant, civil, and human rights. In Congress, she has been a strong voice leading the fight in expanding healthcare access to all, and recently reintroduced her Medicare for All bill on March 17, 2021. Congresswoman, thank you for taking the time away from your very busy schedule to be here with us today. I think it's fair to say that our healthcare system was not equipped to properly handle a global pandemic. This pandemic exposed the many ways our for-profit corporate healthcare is broken. More than 539,000 have died. Millions more have gotten sick, lost jobs, lost their health insurance, and been saddled with devastating medical bills. What has this past year taught you about our healthcare system?
Yeah, thank you so much for putting this on. I really am grateful to the Congressional Progressive Caucus Center and all the groups that are involved, and what a rock star lineup of speakers. And SOFIA really laid it out so beautifully in terms of the vision, right, of what we're trying to get to. So, I think the first thing is the devastating healthcare crisis was just underscored how our for-profit employment-based healthcare system leaves millions of people behind. It is absolutely crazy that in this country, we tie healthcare to jobs. And so what happened when the pandemic hit is a mass unemployment crisis turned into a mass uninsurance crisis. Losing your job because of a pandemic means that you're going to also lose your healthcare during a pandemic. And that's what we saw happen. Unemployment skyrocketed to historic levels during the pandemic. Millions of families lost their health care, and the country experienced the highest increase in the number of uninsured Americans ever recorded. Now, it is undeniable that Medicare for All would have strengthened our response to this pandemic and would have allowed people to seek necessary health services with the security that they deserve. During a pandemic, our healthcare system should have ensured that individuals could go out and seek whatever necessary care and services for COVID-19 or for the other health conditions that they have without fear or concern that cost is somehow going to limit their financial well-being. During a pandemic, every hospital, health center, medical, and public health professional should have been able to respond as a united front rather than the very fragmented way that our country has sought to address this pandemic. During a pandemic, states should not be competing with each other to purchase necessary PPE and tests. And the chaos with testing and the lack of PPE to our essential workers after several months of effort, millions of people ended up losing health coverage, and all of the lives that we lost were non-existent problems in countries with a single-payer healthcare system like Canada, South Korea, or Taiwan. Now, it's true that Medicare for All alone would not have addressed all the barriers and the challenges that were brought forward by the COVID-19 pandemic, but it's also true that it would have largely strengthened our response and enabled people to seek the necessary services with the health security they deserve. How do we know that? Because we have heard from experts in other countries, right? So last year I hosted a panel on the Medicare for All caucus with health experts from Canada, Australia, South Korea, and every single one of us showed us how different it would have been if we had had the same kind of single-payer system here. The Canadian expert showed a video of a press call in which the British Columbia Minister of Health was asked by a reporter, how come Canada has fared so much better than the United States during COVID-19? And her answer was that unequivocally, it was because they had a universal single-payer healthcare system. No one was worried about affording care. And when they needed to get all the health, system leaders in the room to make decisions, they could easily do so because they had a unified and coordinated system. Before COVID-19, there had been debate over whether or not Medicare for All takes away choice. What we've seen during the pandemic, I mean, we knew this even before. I kept saying, what choice do you have when you lose your job and you lose your health care? Well, we got to see that unfortunately happen and unfold during the pandemic, where people literally had no choice because the employer-sponsored healthcare system was no longer available to them simply because they lost their job. The lack of universal health care also has really exacerbated health and racial inequities. I think we all knew that even before the pandemic, Black and brown Americans were much more likely to be uninsured, much more likely to die during childbirth as a maternal and infant mortality crisis ravages our country, and overall have a lower life expectancy. So then we saw during the pandemic that Black Americans were nearly 3 times more likely to be hospitalized than white Americans and are nearly 4 times more likely to die from COVID. So we just can't forget that even before the pandemic, we were already leaving nearly half of all adults under the age of 65 uninsured or underinsured, long before COVID-19 ever hit. And those 87 million Americans were uninsured or underinsured, even as we, the United States, was paying more per capita for healthcare than any other country in the world and getting worse results on so many measurements. So we had a system that left people out, that made people vulnerable, and then made them more likely to die and to get ill, as the Public Citizen report very clearly showed. So it's only more urgent now that we finally guarantee healthcare to everyone in America as a human right. Healthcare with comprehensive benefits, including primary care, vision, dental, prescription drugs, mental health, long-term supports and services, reproductive care, trans care, and more. Healthcare without copays, private insurance premiums, deductibles, and other out-of-pocket costs. And we are moving the dial on this. You are moving the dial on this, because we are starting with 114 co-sponsors, that includes me, 114 members of Congress, 15 committee chairs, and powerful committee chairs, and the public with us around the need for Medicare for all.
Thank you so much for your leadership, Congresswoman. And you're right, while people lost their jobs and had to deal with these medical bills and not be able to see doctors, health insurance executives made record profits during this pandemic. So as you mentioned, you and Congresswoman Debbie Dingell recently reintroduced your Medicare for All bill. Can you tell us a little bit more about the bill, and why is this the moment for Medicare for All?
Yeah, I think it's really what Sophia was laying out, and then what I said. You know, the case has never been clearer, right? We introduced the bill, Medicare for All Act of 2021, exactly 1 year to the date that COVID-19 virus was first confirmed in all 50 states. And in the 365 days since, as you've mentioned, we've lost 543,000 loved ones. And I think it has really just shined a very bright light on how broken our for-profit healthcare system is, and how it was a big contributor to the infections and the lives lost. And so it was, in some ways, you know, we ended last session with over half of the Democratic caucus, as co-signers. We started this session with over half of the Democratic caucus as co-sponsors. That is really significant. There are members of Congress who were here in the last session who were not on the bill, who continued to hear from activists in their districts, and then saw how our current healthcare system was unable to provide healthcare to so many people during a health pandemic, and the cruelty of that. And then they decided to get on the bill this time. I mentioned that we've got the support of 15 committee chairs and a number of very key leadership members. And that includes Chairman Frank Pallone, very powerful chairman of a powerful Energy and Commerce Committee, who was not on the bill last time, is on the bill this time, and has already committed to holding a hearing on Medicare for All. We've also got a commitment from Chairwoman Nydia Velázquez of the Small Business Committee and Chairman John Yarmuth of the Budget Committee to hold hearings. And again, that took us a while to get those commitments in the last Congress, when we held the first ever historic hearings on Medicare for All. This time we're starting with commitments from these 3 powerful committee chairs. Now, in terms of what's in the bill, this is a 125-page bill. And when I introduced it, prior to when I introduced it, we had only had a resolution, a very important resolution, but a single payer resolution, which was about 19 pages, but it didn't really lay out how do we get from here to there. This bill lays it out. It's a detailed blueprint on how we transform the healthcare system into one that finally guarantees healthcare to everyone as a human right. So it builds on the work that we did in the last Congress. It has all of the things that you mentioned. It increases all of the pieces in terms of, even for seniors who worry that they're not, somehow they're going to be hurt out of this because we're expanding the Medicare for All system. It actually expands the benefits that seniors get. It includes things like vision, dental, and hearing. Why would we not include those things for people as they get on in their years? But really, that's something we need to have for everybody. So it's comprehensive care, and it is provided by the Medicare system, so the government. And it also, but you still get to see whatever doctors you want. So it's just the insurance part that is managed by the government. But your doctors, your hospitals, you have way more choice than you would have had with any private insurance company. And ultimately, we are prioritizing patients over profits. We're making sure you get comprehensive care. We're making sure that we're negotiating the price of drugs, right? Because right now, the price of drugs is so unaffordable for most Americans that we've got a lot of people who sit at their kitchen tables and try to, cut their prescriptions to make them last longer. That is just crazy. There are people who are deciding whether they're going to pay rent or get their cancer treatments. That makes no sense at all in the richest country in the world. Medicare for All would negotiate drug prices and allow us to get the lowest prices so that we in America do not have to pay more than any other country for our prescription drugs. So there's a lot of really important pieces in here that ensure that the system we have is actually concerned with delivering healthcare for people. Very last thing I wanted to say is that, I think at the end of the day, I've heard from so many of my colleagues that it matters to them when they hear your stories. I know that my good friend Adi Barkan, was so instrumental in moving his congressman to support the bill. I know that in Florida, Ted Deutsch was really moved by the activists and the advocates who came and told their stories. So I just want to say to everyone who's watching tonight that you are making the difference. We are building the momentum we need, and it is your advocacy and your stories and then my organizing on the inside with my colleagues that helps us to really bring the momentum we need to have this major, major, major transformation of our healthcare system.
Thank you so much, Congresswoman. Thank you for all of that. And so basically, Medicare for all, more coverage, more choices, less money for us. So it's a no-brainer, and we need a Medicare for all system. Thank you so much for everything. Thank you so much for your leadership on this issue and for leading the fight in Congress.
Thank you. Great to be with you.
Thank you. I'm so excited to introduce our next guests, Dr. Abdul El-Sayed and Dr. Micah Johnson, advocates, friends, and co-authors of the recent book, Medicare for All, a Citizen's Guide. Dr. Abdul El-Sayed is a physician, epidemiologist, educator, author, speaker, and podcast host. His newsletter, The Incision, cuts to the heart of the trends shaping our moment. He is a commentator at CNN. His book, including Healing Politics, Calling for a Politics of Empathy to Cure Our Epidemic of Insecurity, and Medicare for All, a Citizen's Guide with Dr. Micah Johnson. He is the host of America Dissected, a podcast by Crooked Media, which goes beyond the headlines to explore what really matters for our health. He is a senior fellow at the FXB Center for Health and Human Rights at the Harvard School of Public Health, and a scholar in residence at Wayne State University and American University, teaching at the intersection of public health, public policy, and politics. He is formerly the health director for the city of Detroit and a candidate for governor of Michigan in 2018. Go Blue. We also have Dr. Micah Johnson with us. Dr. Johnson is a physician and a healthcare researcher, writer, and policy advisor. He served as a health policy fellow in the U.S. House of Representatives and has advised presidential campaigns on healthcare reform. He holds a degree in philosophy, politics, and economics from the University of Oxford, where he was a Rhodes Scholar, and he received his MD from Harvard Medical School. He is currently a resident physician in internal medicine in Boston, Massachusetts. So you two literally wrote the book on Medicare for All. Your book, Medicare for All, A Citizen's Guide, came out at a critical time. We're still battling this pandemic, and millions of people are still struggling to get and pay for the health care they need. Why did you want to write a citizen's guide to this issue?
Yeah, first of all, HEBAH, thank you so much for having us. We're really excited to be here with you today. Really grateful for the leadership of Representative Jayapal and the advocacy of folks like SOFIA and so many others. And we look forward to other leaders with whom we're joined today. If you look at the ways that the corporations that have dominated our healthcare industry, the insurance industry, the pharmaceutical industry, the hospital corporations, the ways that they're able to do that is because they've made our system so opaque that it's nearly impossible to truly understand. It's hard for people to map the failures of that system to the challenges that they face every day. And so we wanted to take the conversation about Medicare for All for a moment back out of the political arena and situate it around the kitchen tables where so many people sit and ask, how do I make ends meet? How can I make sure that I can pay my premium? What's going to happen if I have to pay that $4,000, $10,000 deductible if someone gets sick? And so in doing that, we wanted to break down those opaque barriers that the industry has used to profiteer off of our healthcare system and connect people into that system so that they can find themselves in this struggle. And we want this to be an opportunity, both for folks who've been fighting for Medicare for all along, folks who are skeptical, folks who say that they'd never support Medicare for all, this to be an opportunity to engage with the conversation, understand what the brokenness in the system is, understand how it shapes their lives, and what we can do about it.
And thanks so much for having me on. It's really an honor to be a part of this lineup. And I come to this issue as someone who's always believed that healthcare is a human right. But then I got to medical school and I saw how far we still have to come. And I'm in medical school and now a doctor in Massachusetts, where the vast majority of people have some form of health insurance. But nevertheless, they're still not getting the care that they need, or they're literally going bankrupt because they are getting that care. And then when the pandemic hit, not only was our healthcare system not prepared, but our bodies were not prepared. And I saw working with COVID patients in one of our ICUs that when you have gone decades without reliable access to primary care, when your heart disease and your lung disease has not been treated appropriately for years, you're more likely to get sick and end up in the hospital, end up on a ventilator, and even dying from COVID. So what I wanted to do with this book with Abdul is come at this from the belief that we can do so much better. And it's really a time to deepen the conversation about Medicare for all. Most people understand that Medicare for all would be universal coverage, but it goes beyond that. It's comprehensive coverage. It's about getting rid of the high deductibles. It's about adding vision, dental, and hearing, and a wide network of doctors and hospitals that you can see. It's about cutting out the administrative complexity that drives up costs in the system and also makes it a nightmare to navigate for doctors and patients alike. And it's about cracking down on the high charges that pharmaceutical companies and the big, powerful hospitals charge that drive up costs for everyone. And ultimately, I come at this as a physician. And we've talked already on the program, the political debate is often about choice and about how Medicare for all will take away your choice. But I think about this with my own primary care patients. So they're told that if Medicare for all were passed tomorrow, their choice would go away. But what it looks like to me is that they could come to their appointment just tomorrow the same way they would now. But what would be different? Now they could afford any medication that I prescribe for them. They could finally get the test to see what's going on with their heart. They could call an ambulance and go to the hospital without worrying that that would make them go bankrupt. And they would never have to worry about losing insurance, whether they turn 26, get a job, lose a job, get married, get out of a marriage, no matter what it is, no matter how your life circumstances change, you would be covered. And it's through that belief that we can do better that made me want to write this book with Abdul.
Well, thank you so much for writing the book. And you're right, it's simple. Americans want a simple healthcare plan that includes good healthcare that's easy to use and doesn't break the bank. Our healthcare system is so entrenched and complicated. What is your message to folks watching tonight who feel like they can't make a difference on this issue?
So we know that grassroots organizing can defeat the healthcare industry for health reform because it's happened before. And that's why we have Medicare. Throughout the whole decade of the 1950s and early 1960s, Medicare was broadly opposed by the healthcare industry. And advocates tried and tried year after year, and it didn't pass. But they didn't give up. And it was the organizing by seniors and the labor movement that when the political window opened, they were ready. Just like Medicare for All right now is going through the process of committee hearings and markups and getting more sponsors onto the bill so that it is ready when the moment comes. And the great thing about legislation like this is you only have to win one time. Medicare failed almost a dozen times, but it succeeded once. And now that means over half a century later, whenever I see a patient over age 65, I know that they have health insurance. And the lack of universal healthcare, it is one of the pieces of great unfinished business in our society. And it will be a historic achievement when universal healthcare is passed in this country. And I think that's what makes it such an issue that so many of us are willing to fight for.
Yeah, and I'll add that the fact of this fight is that if you've ever boiled water, right, watched it boil, you know that you heat it, and the temperature goes up, and nothing really happens until it hits a tipping point. And then at that point, the water starts to boil. This is what this struggle will look like. We will work, and we will work, and we will work. And we have to understand that even if the water's not boiling, we're still heating that water. We're getting it closer and closer to that point where it finally boils. One of the things we want to do with this fight was to show folks that everybody has a place in this. In the past, this conversation was almost always about how we provided healthcare for low-income people. And don't get me wrong, that should be enough. But even people who have private health insurance in our system are not well served by it. This is an issue that affects every single one of us. And the thing about it is that, not all of us are going to be professional organizers or activists or congresspeople like Representative Jayapal. But all of us can be organizers with a lowercase o. And what that means is finding ourselves in this struggle and having that conversation with our friends, our families, our loved ones, the people we work with, the people in our communities, our neighbors, and talking about what it is that we hope for ourselves and our kids. Why it is that those deductibles, those premiums, all of those words that nobody really understands, they're too expensive anyway, and it doesn't really get you what you need and deserve. And too many people are failed by this, and we could do better. So having this conversation with folks, that's what's going to heat that water. That's what's going to bring it to a boil. And I do hope that folks find themselves in the struggle, because in the end, we need you. I know that a lot of folks are somewhat frustrated in this moment. They say, well, we've got a president, but he doesn't support Medicare for all. And we may not get Medicare for all in the next 7 years. But I will tell you that it's coming. And what we do right now, how we choose to make use of this moment, that is what will dictate when and if we get it. And so I hope we make the right decisions.
Thank you so much. And thank you for talking about your book. If you all haven't done so already, check it out at medicareforallbook.com. And thank you for talking about the local efforts. We will actually hear from Melinda St. Louis in a little bit about their local resolutions efforts. So thank you so much for joining us today.
Thank you.
Now it's my pleasure to introduce Dr. Donald M. Berwick. Dr. Berwick is one of the world's foremost scholars of healthcare systems. He is a teacher, a tireless advocate, a pediatrician, and a longstanding member of the faculty of Harvard Medical School. He founded and led the Institute for Healthcare Improvement and was appointed by President Obama as administrator of the Centers for Medicare and Medicaid Services, where he served in 2010 and 2011. He has counseled governments, clinical leaders, and executives in dozens of nations. He is an elected member of the National Academy of Medicine and the American Philosophical Society. He has received numerous awards, both here and abroad, and in 2005, Her Majesty Queen Elizabeth appointed him Honorary Knight Commander of the British Empire, the highest honor awarded by the UK to a non-British subject. Dr. Berwick, we're so excited to have you with us. You have a great deal of experience and expertise in improving healthcare systems around the world. Can you share with us your thoughts on our current healthcare system and what has happened during this pandemic? In your opinion, what can be done to improve and expand healthcare during this pandemic and beyond?
Well, thanks, HEBAH, and thank you to the Congressional Progressive Caucus Center. I'm just delighted to be with you. I'm honored to be on the same platform as Representative Jayapal. What a wonderful leader we have for our country in her and many of her colleagues. And to see Micah and Abdul and their book is great. I have to put a plug in for the book. If you want to understand this problem, there is no asset that is more accessible than this one. I don't consider Medicare for All a religion. It's not like, written on tablets. It's nothing but a mechanism. It's a tool for achieving what we want to achieve as a society with health and healthcare. Whenever anybody would propose anything to me, be it Medicare for All or any other proposal, I'm going to subject it to 4 questions. These have become my filter, my interrogation of policy proposals. One is, will it move us toward healthcare as a human right? As you've heard from SOFIA and from Representative Jayapal and others, we are leaving 30 million people uncovered in this country. That is simply an embarrassment, and it's time to make healthcare a human right. It's sensible. It should not be partisan because it helps people that believe deeply in business and the right as much as it does progressive voices on the left. Second, will it improve quality of care? Will every single American be advanced in their access and the quality of what they get to when they're sick or need help? Right now, we have tremendous variability in quality and access in this country, and it doesn't make any sense. We're a wealthy enough country to guarantee quality to everyone. You could see the defects when that goes wrong in the COVID pandemic. The third is, can we reallocate resources? Right now, healthcare is a repair shop. And although we should do every organ transplant that can help, and every cardiac surgery that can help, and every chemotherapy that can help, we need to understand the causes of illness don't lie inside healthcare. They need to be worked on in communities, the social determinants of health. And right now, healthcare is just confiscating resources from so many other areas, education, early childhood, food security, housing security, that actually create the illnesses that Mike is having to deal with now in his residency in the repair shop. Right now, we're misallocated. And so I ask of any policy, will it help us invest in the real causes of illness? Then the fourth question is, will it reduce cost? We're at 18% of GDP. It doesn't make any sense. We're 40th in mortality, 40th in life expectancy, and we're way almost double the next most expensive country. We are not spending money properly, and we need to get control of the prices that are right now confiscatory. So what policies will get us there? I'm open-minded. I'll take any policy you want to put on the table if it will answer those 4 questions. The problem is we haven't got any other than this proposal, some national health insurance scheme, which creates universality, allows us to focus on problems together, can move money where it matters, and can get control of these outrageous costs that people are dealing with. The Massachusetts Health Policy Commission had its annual cost trends hearing today. Over 50% of people in lower income levels with chronic illness can't afford their care. And over 30% of people not in lower income levels say that they're forced to make trade-offs because of the cost of their health care. One of the big ideas also behind this is to be able to focus as a nation on problems. The COVID pandemic is taking us to school on this. We need to be able to organize as a country and address a very, very serious threat that's taken half a million American lives. But there's a long list of problems that we also need to focus on. Opioids and their consequences, chronic illness and its growth, and the wages it takes out of well-being of our population, patient safety issues, equity issues, aging. We need to be able to organize as a nation to tackle these issues, but we can't. We have no way to organize. When I was running Medicare and Medicaid, we could have a meeting and say, what are we going to do about nursing home quality? But we need a whole nation that can mobilize toward health. And I see this as the best shot. It's the best way to get there. If someone will come with another alternative that will provide comprehensive coverage for absolutely everyone, continue to improve quality of care and let us focus on problems, move resources to causes of illness, to prevention, and reduce waste and confiscatory costs, I'm open-minded, but I haven't seen a proposal like that other than this one. So it's right. Politically, really, really hard. But I love what Abdul was saying. It's going to come in its time, and its time is coming.
Thank you so much, Dr. Berwick. And you're right. I mean, as everyone has said, Medicare for All is the policy solution. It'll save lives, more affordable, better coverage. It's very simple. So thank you so much for being with us. Thank you for sharing with us and for all of that great information.
Thanks for having me.
Of course, thank you. It is an honor to introduce our next guest, Dr. SANJEEV SRIRAM. Dr. SRIRAM is the co-founder of the All Means All campaign, a campaign dedicated to centering racial justice in the fight for Medicare for all. But you might know him by his other name, Dr. America. He's a health justice correspondent for We Act Radio. He writes about connections between health policy, inequity, and social determinants of health. Dr. SRIRAM completed his medical degree and his pediatrics residency at UCLA, where he served as chief resident at the Department of Pediatrics. In June 2009, he earned his master's in public health after completing the Commonwealth Fund Mongan Fellowship in minority health policy at the Harvard School of Public Health. He currently practices in general pediatrics in Southeast Washington, D.C. Dr. SRIRAM, thank you for being with us today. So you helped found the All Means All campaign at Social Security Works and have been dedicated to making racial equity a cornerstone of Medicare for All. It is no secret that communities of color have been disproportionately affected by COVID-19 in every measurable way. Sophia had talked about it earlier. How has the underlying racism in our healthcare system affected communities of color during COVID-19?
Yeah, thank you for having me. Our team disproportionately infects and kills people. About why people of color have higher are not the biology of people. Like Sophia said, the virus is not racist. Pandemics are not about the failures in people's bodies. COVID-19. Yeah.
Sorry, I think we're having a hard time hearing you.
Uh-oh.
It's yeah, the connection seems bad, at least on my end.
Can you hear me better now? Is this?
I can hear you, but the connection's like going in and out.
Huh.
We can come back to you. We can go to Melinda and come back to you.
Okay, that'd be great.
Okay. Well, now I can hear you fine.
Is this better now? Can you hear me?
I think it's an internet issue. Okay.
To Melinda and come back to me.
Okay, yeah, we can do that. Okay, sorry about that, everyone. Technical difficulties. We'll come back to Dr. SRIRAM. So I'm excited to introduce our next speaker, Melinda St. Louis. Melinda is the Director of Public Citizens Medicare for All campaign. For the past 20 years, Melinda has led multiple campaigns that challenge corporate power and promote economic justice and human rights, and received a master's degree in public policy from Georgetown University. Melinda, it's so great to have you with us. I know you've been really busy this past year organizing. Can you tell us a bit about your efforts around the local resolutions and popular support for Medicare for All? Oh, Melinda, I think you're on mute.
Sorry about that. So sure, I'm really honored to be part of this impressive panel of experts and leaders for healthcare justice, and thanks to the Congressional Progressive Caucus Center. What I think's been made crystal clear already on this panel, and the excellent town hall that Representative Jayapal and Representative Dingell led last week when they introduced the Medicare for All bill, is that improved Medicare for All is the solution to our inequitable, expensive, and inefficient healthcare system. The facts and the moral imperative are on our side. Our challenge, as Abdul and Micah mentioned, are that this is a political challenge that we face. The private insurance companies, big pharma, and the large for-profit hospitals spend enormous sums to lobby on both sides of the aisle to maintain the status quo and to maintain their billions of dollars in profit. And that's why what's really clear is that the way we will win this policy is to build the massive grassroots movement powerful enough to overcome this enormous influence from these corporations. So we and a host of partner organizations representing doctors, nurses, patients, workers, small business owners, community organizers are working all across the country to build local coalitions, to educate our neighbors, our local media about Medicare for All, to counter all the misinformation and lies that are being spread, and to develop pressure campaigns to convince elected representatives to sign on as co-sponsors to the bills. One powerful tactic that local organizers have been employing across the country is involving municipal governments all across the country. City and town councils and county boards have been passing resolutions in support of Medicare for All. Why is this? Local governments can play a really important role in highlighting the desperate need for Medicare for all. They understand all too well the consequences of our unaffordable and equitable healthcare system. Municipal budgets have been increasingly strapped as health insurance premiums increase. Local businesses are struggling to make ends meet due to rising health insurance premiums. Local governments provide frontline response often when community members face medical debt bankruptcies, or they become gravely ill, or they die needlessly because they lacked adequate health insurance. And all of this has become even more dire in the context of COVID-19. So we have more than 300 local efforts underway in red, blue, purple states and counties across the country. More than 55 local resolutions have passed in cities and counties as diverse as Los Angeles, but then Knoxville, Tennessee, Philadelphia, and South Bend, Indiana, New Orleans, Tampa, Putney, Vermont, Bethlehem, Pennsylvania, Kalamazoo County, Michigan. So we're seeing this coast to coast and everywhere in between. Our coalition has put together a comprehensive activist toolkit and a map where activists can plug into local efforts in their town or add their town or county to the map and be connected to other interested activists in your area. So that map and toolkit can be found at MedicareForAllResolutions.org. Especially since the pandemic, more and more municipalities are putting themselves on the record in support of Medicare for All. There's also a separate effort of mayors for Medicare for All that was started several months ago on its own by the mayor of Long Beach and Oakland, California. Mayors are joining them across the country as well. It's been really incredible to see the enduring local coalitions that have been built through working together to pass resolutions in their towns. We've seen powerful testimony that patients and workers and business owners and health providers have given at municipal hearings, local press attention, op-eds, letters to the editor, and then building in-district meetings with members of Congress that these local coalitions have engaged in. And that's really translated into broadening and deepening the movement. And it's encouraged more champions of Medicare for All legislation in the House, and we plan to continue that over the coming period. So we really encourage folks who are fired up by the incredible presentations of these experts to sign up to be a part of this growing movement. And you can join that at MedicareForAllResolutions.org. So thank you so much for having me on this panel.
Thank you so much, Melinda, and thank you to you and Brittany, a public citizen, for all of the work. I know you've been working really hard, especially throughout the pandemic, on the local resolutions effort, and yeah, grassroots organizing work. So thank you so much for your dedication and your passion around the issue and for everything that you do. I think we're going to go back to Dr. SRIRAM if he's available now. I believe he might have his connectivity.
Yeah, I think we're good to go. Sorry about that.
No worries. Do you want me to repeat? I don't know where we left off. Let's see.
Yeah, we were talking about the underlying racism in our healthcare system and how that affected communities of color during COVID-19. And, you know, what I really want our audience to understand is that this virus, like Sophia said, the virus is not racist. You know, pandemics are not about the failures in people's bodies. They're about the failures in our society's policies and systems. COVID-19 took advantage of America's pre-existing conditions: poverty, inadequate housing, unsafe jobs, desperation wages. These problems Dr. Berwick mentioned overpower individual choices and behavior, no matter how good a person might be. You'd be asthmatic too if you lived like some of my patients. Your blood pressure would go up if you worked like some of the families I see. My patients struggle to stay healthy because our society is very sick. Our economic and healthcare systems have pre-existing conditions of racism and exploitation. Among Black workers, only 1 in 5 could work from home at the start of the pandemic. Among Latinx workers, only 1 in 6 work from home. Our economic system painted a target for COVID-19 on the backs of people of color who've always done this country's essential work. People of color often work with 0 health benefits because they're classified as contractors or temps indefinitely. And Medicaid is either unavailable or too complicated to enroll in, depending on what state you live in. add absent or unenforced workplace safety rules, and it's like our economic system added blinking lights to that target it painted for COVID. If you do feel sick in America, it's not easy to just stay home or see a doctor. There's no universal paid sick days. Going to the doctor means co-pays, deductibles, out-of-pocket expenses, and that deters many patients, but especially people of color, from seeking care. The insurance companies patted themselves on the back for waiving some co-pays in COVID, but look at how high all of our premiums and deductibles were last fall during open enrollment. These are just a few of the chronic failures of our healthcare system, pre-existing conditions that COVID took advantage of. Our current healthcare system has failed communities of color for generations and did nothing to shape up during the pandemic. While COVID-19 infected people of color at 2 to 3 times the rate the virus infected white people, the insurance company CEOs got bonuses. While hospitals in poor and rural communities struggled to stay open in the middle of a pandemic, the private equity firms that were supposed to help them made billions of dollars in record high profits. Our health policies need major overhauls. COVID-19 just proves that point.
Thank you. Thank you for sharing all the important information. It's clear that the communities of color are disproportionately wronged by our current healthcare system. Can you talk about how and why Medicare for All is a critical step towards racial justice?
Yes, and I want to start by being honest and reasonable. Medicare for All is not a cure-all to end all racism in healthcare. Even after we win and build Medicare for All, there will be a lot of work for us to do for meaningful racial equity. That said, Medicare for All is a critical part of building racial justice, and it does so in 3 major ways. First, with Medicare for All, your humanity is your eligibility. Our healthcare system splits people into so many fragments of deserving, undeserving, with people of color churning in and out of coverage. What state do you live in? What is your employment status? How much money do you have in the bank? What is the citizenship status of your family? Regardless of whether or not you think these questions have racist intent behind them, they have racist impact. The All Means All campaign has the data to prove it. 59% of America's uninsured were people of color prior to the pandemic. That is not an accident. Medicare for All ends the obstacle courses my patients and families struggle with every day. Rather than scrutinize a person's worthiness in healthcare, Medicare for All keeps it simple. If you are a person living in America, you're covered. Second, the coverage under Medicare for All moves with you and your family no matter what. This economy has been devastating for communities of color with unnecessary ripple effects on healthcare. Medicare for All is about reliable, portable coverage. Lost your job? No problem. You're covered. Got a new job? You don't wait 6 months for healthcare benefits to kick in because Medicare for All has got you covered. Getting married or divorced, moving across state lines to pursue a new job or be closer to family or further away from someone, no problem. Medicare for All has got you covered. These life changes happen to all of us, but for people of color, these life changes are disproportionately part of economic struggle and that churn of gaining or losing coverage. The reliability and portability of coverage under Medicare for All means my patients and I can work together through all of life's changes without disruption. The third way Medicare for All builds racial justice is through equitable funding for clinics and hospitals. Right now, hospitals and clinics in the wealthier white part of town never seem to struggle to stay open. Meanwhile, hospitals where mostly Black and brown people live or are located in rural communities are constantly struggling financially. For example, Southeast DC is predominantly Black. There is not a single labor and delivery ward in the southeast part of our nation's capital where a pregnant woman can give birth. She has to commute to wealthier, whiter parts of DC, where hospitals are never in financial trouble because most of their patients are privately insured or they pay cash. When hospitals chase those big dollars, they become more and more about serving wealthier people and less about the communities around them. With Medicare for All's global budgets, hospitals and clinics get a reliable funding stream to stay open, strengthen services, and fulfill their duties to their communities. Being a hospital or clinic in a rural community or poorer neighborhood will no longer be an excuse for substandard care. Medicare for All can strengthen hospital and clinic budgets to retain staff, maintain programs, and commit themselves to the health of their neighbors, not the wealth of private equity funds. This is an exciting investment in the health of our communities of color, right where they live. There are many other ways Medicare for All builds racial justice, including lower prescription drug prices and reliable, high-quality long-term services and supports, all of which have been beyond reach for communities of color. What I want this movement to commit itself to is centering racial equity in Medicare for All, rather than making it a vanity project or some afterthought. Let's make sure all means all.
Thank you so much, Dr. SRIRAM. Thank you for joining us and for fighting for racial justice while you're also saving lives. Thank you for all you do. And yeah, check out the All Means All campaign at the Social Security website. So this has been a truly moving evening with all of you. I'm so excited by all the energy we have to ensure that the basic need of high quality healthcare is a guarantee for all. Please join me in thanking all of our guest speakers once again. Sofia Sepulveda, I'm pretty sure I'm pronouncing her name wrong, I'm sorry, Sofia. Congresswoman Pramila Jayapal, Dr. Abdul El-Sayed, Dr. Micah Johnson, Dr. Donald Berwick, Dr. SANJEEV SRIRAM, and Melinda St. Louis. And before we go, don't forget that at the end of the day, policy alone doesn't make the change. It's the people who have the power to make the change. And tonight's discussions would be meaningless without your support, passion, and fire. Thank you all. Good night and stay safe, everyone.